Thank you, Beth. Good evening, everyone. Thank you all for being here this evening. We really appreciate you showing up just to listen, and we hope you find this very informational, informative. We're looking forward to hearing some of your feedback and your questions once the panel finishes this discussion. First, I just want to thank the library, thank Beth, thank Tamara for allowing us to be here today. Beautiful facility, my first time here. So thank you. This is a top-notch, excellent room and facility, so thank you. I also like to thank our panelists who will introduce themselves here as we go kind of round robin as we discuss the different topics and questions that we have. So thank you for taking your time out this evening. We appreciate you. And thank you all. Thank you all for being here. It really shows your level of engagement for wanting to receive some of the information and as well as participate in any interactive discussions. So thank you. We appreciate you being here. Thank Dan from Avalon Housing. Our mission advancement team is our team that does a lot of our outreach, communications, and fundraising. So they work to set this up and to bring the different speakers together. And lastly, I do want to acknowledge we do have a couple Avalon staff and board members here, so I just want to make sure I acknowledge them and thank them for their hard work and support of myself and everything we do. So thank you. All right. So without further ado, why are we here today? So we have a small few pages, few slides here that we're going to talk a little bit about. But our topic today is aging in a good place, solutions for homelessness, and housing affordability. So our conversations, our questions will revolve around those. But again, once we get through our topics, feel free to ask. We have a host of knowledge and expertise here, so I'm sure we can answer it or at least provide a level of resources for you. So a little bit about myself while I change the slide here. As Beth mentioned, I'm the executive director at Avalon Housing. I've been in housing now about 16, 17 years. My background is in affordable housing, public housing, like Lisa with the Housing Commission here. So I've held multiple roles in housing, from just being almost like a receptionist type of positions, doing recertifications, asking questions, to director, to executive director. So seen a lot. Been in a lot of different housing authorities. I'm from Ohio. Please don't hold that against me. I understand. I love Michigan, by the way. Beautiful state. So again, I've been around, seen a lot. But the one thing that is for sure and for certain is that the challenges remain the same. Okay. So a little bit about Avalon. So here's just a touch of some of the statistics that we have. So Avalon Housing, if you didn't know, we have 29 properties, roughly 388 units currently. We serve around 800 individuals totally. About 200 of those are children. Roughly 30% are what we say seniors. HUD has a different definition of seniors. HUD's definition is 65. When I say HUD, that's the Department of Housing and Urban Development. Their definition is 65. Our definition for our purposes is 55. And we'll talk a little bit about those reasons as we get into the slides here. So again, we have 29 properties. We have roughly 150 in kind of development stage. We are partnering with the Ann Arbor Housing Commission with the project that you probably see under construction on Catherine Street downtown. We have another 50 units of mainly family. It's called the Grove. That's the short name that we use. Villages Grove at Meridian, which will be opening up probably in the spring of 2025. And we have 22 units, single bedroom units that will be opening probably early 26 in Ypsilanti. It'll be our first development downtown Ypsilanti at 206 North Washington, which is just a couple blocks up from where the bus transfer system is. So, again, we serve around 800 individuals, 380 units. We have a staff of approximately 135 staff, 75 of which are our support and service staff. So we're really heavy on services. That's really what we do. We're a permanent supportive housing provider. We have a property management department, a development department. That is the actual department that develops the properties and works with the city and the state and local officials. From our support staff, we do a number of services. So I'll just mention a couple of services that we provide. Eviction prevention, mental health support, recovery services. We work with those that are justice impacted, reentering society, and try to find housing for those. We work with some that's not properties that we own. So some are, your neighbors and your communities, single family homes, duplexes, you name it. I think one of the best things that I can say that we do is, we help build those community connections. So often, folks can feel isolated. Those that are potentially have a certain income or have certain disabilities or what have you can feel isolated. So we try to make sure that we connect them with community resources, but make sure that they know they are a part of the community. Next slide. Okay, so again, we're talking about aging in place today, and this is just a slide that demonstrates kind of the growth. So this is the age homeless population, obviously is growing rapidly if you can look at this chart. We took it back from 2017 to current and through forecasted growth. And that's a statistic that I think is really alarming. There's many reasons. I'm assuming that we all could speculate, but that's something that we're here to talk about and talk about some of the solutions to that. And so hopefully that forecast is not as accurate as it looks as of today. All right. What you see here is just a local snapshot. So what we was trying to demonstrate here again was just the population percentage, okay? And this is locally. This is here in Washtenaw County. And so this chart here, when someone is being assessed in terms of their abilities as they come and exit out of homelessness, it's a scale that's used. It's from the Department of Housing and Urban Development. It's a scale, and it's called SPDAT, all right? I do not know what it stands for. I'm sorry. I can get that information. But it's a scale that we use, and it measures. There's several factors that go into it. But, again, it kind of measures the criticalness in terms of the resources that you need if you are exiting out of homelessness. So here, this first one here is, as you can see, 2020, 2021. So roughly 3 years old. And 24% is, again, we have it circled 55 because we deem senior or elderly at 55 for the purpose of supportive housing. So 55 and up plus 65 is 24%, right? Or was 24%. Oh, that's okay. That's okay. Don't worry about it. I would just say go ahead, but, for sake of time. For the next picture here that's demonstrated is now we move to current 2024. So you can see that increase from 24% 3 years ago to 32%. And that's reflective of the slide that we just had. So it went up to 32%. Now what I really find alarming is if you look at the second box, Black or African American, at 71% of that 32%, 71. Now in this county, African Americans only make up roughly 12%, but they make up 71% of those that are suffering from exiting out of homelessness. So we know we have some work to do, and that's reflective of the country, not just Washtenaw County. So it's not a depiction of this county. That's a depiction of the country. Many reasons why, and again, we all can speculate, and we probably all have a level of understanding why, but we'll talk about some of that as we continue. And so, in short, again, so to not to belabor and for this to be roughly, about Avalon, is the true solution is really a coordinated response, right? So we're a housing provider, we're a supportive housing provider, but without you all, we just passed a senior millage, and so I really have to acknowledge and congratulate you all because, again, that's a millage, again, that taxpayers are paying that's dedicated to seniors. That's something I haven't seen in other communities that I've worked in, and so that really says a lot, about the citizens here in Washtenaw County. But we truly, this truly is a collaboration and a coordinated effort. These are just some of our partners that are represented up here on the panel today. But again, it takes a whole village to try to solve these problems. They're not solved overnight. I think we know that, but we're up here to try to provide some of those solutions. So again, just wanted to give you a few slides about who we are in terms of Avalon, and just kind of set the stage for what we're going to be talking about today, okay? Or this evening, I should say. All right. So I think one of the first things we need to do is we're going to have the panelists here introduce themselves, talk a little bit about themselves, where they're from, and then we'll get into the questions. So I guess we'll start here with you, Lisa.
Perfect. Good evening, everyone. My name is Lisa Levan. I'm with the Ann Arbor Housing Commission. I am the manager at Lurie Terrace Senior Apartments here in Ann Arbor. A little bit about me. I'm from Jackson, Michigan, so I do commute. I did live out here in Washtenaw for quite a few years and moved back home, I guess you'd say. I started with the city in 2018, and I have been there ever since. My journey with the city started on the voucher side, so I was issuing Section 8 vouchers, mainly special purpose ones, so people with disabilities. The latest one was the mainstream vouchers is what I was doing for non-elderly disabled folks. So after that, I moved over to Lurie, and I've been there ever since. Yeah, I'm excited to be here tonight. Thanks.
Thank you, Shannon. Karen?
Hi, I'm
Or
Karen.
Lisa, I'm sorry. Karen.
Okay.
Oh, what'd you say?
No, go ahead. No, I'm
I'm
sorry.
sorry. I'm Karen Lanza. I'm originally from Connecticut. I went to law school in New York, and I came here for graduate school at University of Michigan. And I have recently been involved with Avalon's Voices of Community Advocates and Leaders. That's a group of people that are Avalon, I'm sorry, I'm not talking in here. Avalon tenants that are out doing advocacy and leadership and community building. And also I work with HHSBC, Housing and Human Services Board for Washtenaw County, and the Recipient Rights Committee at the University of Michigan. My background is really kind of law and academic, but in the last, well, I guess all my life really, I've been more of an activist. So when I got more involved with Avalon, I started getting more involved with housing issues.
Thank you, Karen. And Karen is an incoming board member for Avalon Housing as well. So she's one of my supervisors, if you didn't. She will be. And last but not least, Shannon.
Hi, I'm Shannon Gilroy. I'm a licensed social worker with the Shelter Association of Washtenaw County. My role there is the Recuperative and Crisis Coordinator, which means that I run both our recuperative care and our housing crisis stabilization programs. Today I will speak more about recuperative care as it relates very heavily to the topic of tonight. I was born and raised in Michigan like these folks. I graduated from Eastern Michigan University, and I'm happy to be here with you guys tonight.
Thank you, Shannon. All right, without further ado, we will get into our round robin questions now. And again, we will save time at the end for all you all that have questions. So, and we hope you find this informative. So, question one is going to be for Lisa. All right, Lisa. With the rising housing costs, many seniors are at risk of being priced out of the housing market, even if they were once stable. How is the Ann Arbor Housing Commission addressing this growing need, and what strategies are you implementing to ensure seniors have access to affordable housing?
Okay. So what's wild about this is that seniors are absolutely at risk for homelessness, and the data that you provided is actually really scary because a lot of the seniors that are becoming homelessness now have never been homeless before, and that's a really scary place to be. So it's something that us at the Ann Arbor Housing Commission talk about frequently. Some of the things that we're doing currently is we're constantly looking for funding and grant opportunities to keep rents low at the senior complex that we do own currently. For instance, right now we are in the middle of installing a fire suppression system. And in doing so, we have to do a whole bunch of stuff outside of the building to get the water line into the building. While we're doing that, we might as well look for ways to make our operating costs lower long term. So we're looking at solar gardens to help with energy efficiency. And that in turn will help keep the rents low at Lurie Terrace. We're also always looking for ways to expand our housing stock for the senior population. And that's just an ongoing battle to find different areas for us to purchase property to house seniors. So, yeah, we're really looking for different ways to make funding happen.
Absolutely. Karen, I know you're on the committee for the Catherine Street project.
Yes.
Anything you want to mention about the building and your input, the input of the committee?
Actually, that building probably won't have that many seniors. It's gonna be, but I mean, I really don't know who's on the wait list, so I guess a lot depends on how that gets structured. And it's also gonna be half of the people there are gonna be like kind of starving artists, so, and that's kind of a broad sense of art, not just people that are painters or sculptors, but they could be photographers, dancers, whatever. And so that's kind of filling a different kind of need.
Okay.
So I think we do need to focus a little more on senior housing, and I would hope that this new millage would make us do things that are kind of exciting, like somebody, I think you mentioned it, or did you mention the socialization? Somebody mentioned socialization as being important, and I think that that's a big part of it, is getting people more active in the community and getting people to feel like they're less lonely.
Sure,
and
absolutely.
Because even when people get housed, if they're newly housed, a lot of times they tend to either stay to themselves or, they don't feel like necessarily welcome to open up and meet other people. So, there are programs like at Miller Manor and other places that Avalon runs that are straight for seniors.
Okay. Thank you. And Lisa, are there special vouchers for seniors at the Housing Commission? As someone from public housing, and that's my background, are there special vouchers for seniors that HUD allows you all to administer?
Not that I know of right now. We do have 30 project-based vouchers at Lurie Terrace. And we do work off of a waiting list for that. It's open, so anyone can still apply. But we're able to fill those as they open.
Okay.
So
Awesome. Okay. Sounds like we have some advocacy to do, right? We can advocate for specialized vouchers. There are others for specialized populations that HUD does allow. So we can advocate for special vouchers for seniors too. So just throw that out there, right? All right, we'll move on. Shannon, the Shelter Association, over the past few years, have you seen an increase, I should say, within the Shelter Association in the number of seniors seeking services?
I mean, absolutely. I mean, you saw some of the slides just showing like the general increase, but especially since COVID, we've seen an increase in seniors in the shelter, and I would say it's really our largest population that we're seeing at the shelter, which provides its own sort of challenges, as you can imagine. Trying to provide appropriate wraparound supports and things that the seniors need has been challenging. And we're working with our community partners on getting these folks housed quickly so that they're not just lingering in the shelter setting. But something that the shelter has done to kind of try to adapt to this growing need is by addressing the medical frailty of these clients. So as you know, it's just common sense that as people get older, their health declines. Because of that, we're seeing more and more folks experiencing homelessness that are having these health issues. And to try to kind of adapt and meet those needs, the shelter started their recuperative care program. They started that in 2019. It had to shut down because of COVID, and then we reopened it in 2021. Started with 8 beds. We now have 12, hoping to build up to about 20. But that program, what it does is it allows for folks that have just had surgery, or say they're going through chemotherapy, or they need wound care. We put them up in a hotel setting where they have 5 days a week of nursing from Packard Health. And then I work with them on their housing situation to try to get them housed and stabilized. We've really been able to partner with Avalon in that program as well with their rapid rehousing to get folks housed more quickly and open up those beds for more people to come through the recuperative care program. Right now, like I said, we're run out of a hotel. We are hoping to expand that into more of a standalone facility setting to be able to service more folks. So that's just like one of the things that the shelter has done to try to like adapt to meet these growing needs in our community.
You mentioned, Shannon, you mentioned rapid rehousing.
Mm-hmm.
For the audience, could you just tell them what that means?
I don't want to speak out of turn.
Oh,
here,
that's okay.
but,
That's okay.
So rapid rehousing, essentially the goal is to get folks housed as quickly as possible. And then there are some financial supports that can come with that to assist with paying for things like rent, so that folks can either save their money to do certain things with, or let's say they're working on legal troubles, paying off legal troubles, or a past eviction. Avalon kind of takes care of their rent needs so that they can handle those other things, which hopefully stabilizes them and allows them to stay in housing for longer. What's nice is Avalon, in their rapid rehousing, works with what's called My Care Connect, which is like a hub that a bunch of different providers use, including the hospitals, CMH, where we all kind of gather together to do wraparound services for those clients. So with rapid rehousing and the MICC program, you have medical case management and housing case management together, which really can help with folks in the senior population that are experiencing these, significant health concerns.
Thank you, Shannon. Thank
Yeah.
you. Thank you. Okay, Karen, question for you. I know you are an avid community advocate. You're on many boards and committees in the community. So I'd just like to ask you, are there specific policies or initiatives that you are advocating for, or any organization that you're a part of?
Well, right now, I guess my biggest thing is what are we going to do with that money from the senior millage? Because one thing that no one's mentioned is the memory care and how expensive memory care is. And just listening to, I keep forgetting your
My name is Shannon.
name. Shannon told me earlier that people can be turned down for treatment at U of M for cancer if they don't have a place to live. And it blew me away, but I also thought about, well, what happens to people who can't afford $7,000 a month for memory care? My father was in memory care. It was like $8,000 a month. And if you don't have that money, Medicaid doesn't pay it, and there aren't enough of those facilities, and I think we need to start addressing making that something. I don't know if we need to like somehow come up with housing that's mixed or some new building or something, but or either somehow giving money. I kind of don't like the idea of giving the money to the extent the people that are already running these things because they make so much money. I would like us to come up with our own alternative, like we want to do with electricity. Let's do it with senior housing, especially for this population, because a lot of this population, you have a 31% higher chance of getting dementia if you are somebody who's chronically lonely. And that's been written like in several medical papers. It's not just something I'm coming up with. And Black people tend to have more dementia than whites. And then you're saying that, 70% of your older adults are Black, so you're gonna start seeing this problem. And what are we gonna do about it is my big thing right now.
Good point. Good point. Thank you. Thank you, Karen. And for the audience, for you all that don't know, one of the biggest tools, tools that we use, whether it's Avalon, whether it's the Housing Commission, whether it's the Shelter Association, not just here locally or statewide, is what's called the Housing Choice Voucher. MISHDA, which is the Michigan State Housing Development and Finance Agency for the state, is appropriated so many funds for housing, regardless whether it's senior, family, or what have you. This voucher is really critical because it subsidizes the rent for many that can't afford the market rate. I think the 60% of AMI, just 60%, not 80%, not 100, 60% of the area median income here in this county is $52,000. You have to make $52,000 a year, and that's 60%. And so for our families, the majority, I think our last statistic when we did an average for our seniors specifically is around 15,000. And so it's primarily Social Security or SSI as the primary source. And so if the area median income is 52,000 and you are at 15,000, then you priced out the market. There's no way that you're going to afford, and that's only for affordable housing. We're not even talking about market rate. And so for the Housing Commission as well as ourselves, we keep our rents at or below 60. Very rare do you see anything higher than 60 in affordable housing. There are some mixed market rate housing within complexes within Ann Arbor Housing Commission as well as Avalon. But the highest rents for us is $600. So the new building that I was just mentioning to you all, the Village at the Grove, brand new construction next to $1 million condos. Our rents are set at $600 for our one bedroom. So, you know, without creativeness like that and without the tools of like this housing choice voucher, it makes it virtually impossible. And right now, Michigan has stopped issuing vouchers. The federal government has stopped appropriating them funds. Essentially, they have ran out of funds, so they had to stop. So we're hoping come 2025 that they will restart first quarter of 2025, but we just don't know. So again, that's something else that we as a community and the people can advocate for, and our voices can be heard. Okay. Next question. This is more for all of the panelists, so I guess just pick on us. Lisa, I'm gonna start with you since you're closest to me. Okay, is that all right? All right. Collaboration among service providers is key to addressing homelessness. Could you speak to the partnerships that you're aware of or that you have been a part of that have been instrumental in helping seniors move from homelessness into stable housing?
So at Lurie Terrace, we are partnered with Huron Valley PACE, and they have done an amazing job at providing resources for seniors that are currently living at Lurie, as well as new admissions that are coming in. So it's not uncommon for me to move someone in that needs a bed, needs clothing, and we work very closely with Huron Valley PACE to make sure that they have what they need. I mean, across the board, though, for the Housing Commission, we work with we work with Avalon, we work with SOS, and I'm sure they've assisted with seniors across the board with getting them housed.
Thank you. Shannon, what about yourself? You're at the Shelter Association, so I know, you know, that's more of a temporary housing situation where you try to get more permanent solution. But I'd be interested to know any partnerships.
Yeah, I mean, I spoke a little bit already about our partnership with Avalon and how important rapid rehousing has become to our community with the lack of those vouchers that you were just speaking on. Ann Arbor Housing Commission as well has those project-based vouchers, which makes rent affordable, well, mostly affordable for folks. I just want you all to picture, you know, somebody who has $900 a month in income. Our rent, I can't find an apartment for less than $750 or $850 in our community, if we can find that. That's like a diamond in the rough type situation. So how do you house someone without a voucher that makes rent affordable? So we've really leaned on our partnerships with, you know, Avalon, Ann Arbor Housing Commission, and Michigan Ability Partners to make that rent affordable for folks so that we can get them housed.
Thank you. Thank you. Karen, would you like to add anything to that?
Oh, I guess I could just talk about a specific. I can attest that you do a really good job with that, because I do know somebody who had to recently go through the recuperation from COVID in the in your housing, and I'm glad that we are finally starting to see housing as a right. I lost a friend last year who I met. He was homeless, and I met him about 20 years ago, and he didn't get housed until about 6 years ago. And it was because there was no housing first. And once he got housed, he had found out about a year later that he had stage 4 lung cancer. He went to the emergency room for a back problem, and they said, "Oh, you've got lung cancer, but it's gone to your bones." So it's very immediate for me, this issue. And I think when you see people on the street, sometimes it's just easy to walk by and say, well, what's their problem? Or, you know, better luck next time. But, you know, we really need to look at what we're doing. We can't just throw people away, you know, and I'm glad that this county has a commitment to housing people and putting money behind that commitment, and because it's not a commitment if you're not putting any money in it. And I'm glad that there's good people working in all these different organizations.
Thank you. That's a great segue, Karen, and you said something there, and I made a note. But you know, other than housing, and you talked about the community as a whole, other organizations. Other than housing, I like to just ask you, what other services do you think that we need? If we have them in our community, fine. If we don't, you being from another state and being around in different states, what other services would you say that need to be with housing?
I think we need something that lets people develop their talents, and it's something that we forget people have. You know, I mean, people get a house, they get a place to stay, but, you know, they need to feel self-actualized. I mean, that might sound kind of Adler, but, I mean, it's true. I mean, I think people want a sense of, you know, you have to feel like there's a purpose to your life, and that's the one thing I don't see us doing that much of. I mean, it's easy for people to get a job in a kitchen at a restaurant or something, but, you know, outside of something like that, we're not really trying to figure out how we can help people develop whatever talents they have, whether it's like, okay, maybe you can become an entrepreneur, and, you know, maybe you're good at making widgets, or maybe you need access to a professional kitchen so you can sell your wares at a grocery store, at the farmer's market, or, you know, we just need to open up our imagination a little and start letting people into more than just the housing sphere. We really need to really welcome them as members of the community.
Excellent, thank you. Shannon, what about you? I'm interested to know, being at the shelter, you know, seeing the need, you know, in all seasons, at all ages, and all walks of life. What other services would you say that, if you had to name a couple top services, what would you say?
Yeah, I think the biggest is healthcare. So the homeless population generally has a distrust in healthcare system in general. So what I've seen that has been really amazing is, I'll just give a shout out to Dr. Ravi, who was not able to come tonight, from Packard Health, who is actually doing house calls at Avalon. So he's going to people's homes and he's making those connections in a place where they feel safe. And because of that, people are getting the preventative care that they need to live longer. And building those relationships with the healthcare professionals is just, I find that to be invaluable and like super important, especially for, you know, our aging folks who maybe have never had a primary care physician before. You know, medical things can get in the way of your housing as well. You know, say you end up having a huge medical bill and then all of a sudden you can't pay your rent and et cetera. So like just having those preventative services and basic connections is really important in my experience. Yeah.
Thank you. And shout out to Dr. Ravi.
Yes.
I don't know where the camera's at, but Dr. Ravi couldn't make it today unexpectedly, so we our prayers to him, but shout out to him because he does really make, as Shannon said, house calls on his bike in the winter.
Yep.
I don't know how, but that's what he does, and so really shout out to him. Well, I think that concludes our at least scheduled questions, and so yeah, We have plenty of time. So that concludes our scheduled questions, and now I think we want to open it up to you all. We'd like to hear from you. Any solutions, any questions that you have, we can try to answer them. If you have just free thought or solutions or what have you, we'll jot them down. Us being in this field, we have contacts, we have resources. So if there's things that we can do that you think can help, that's what we're here to do.
Great, thank you. Let's give them a round of applause. So we have our first question, and remember, we're going to need to ask questions in the microphone.
Okay, yes. I do currently have a housing choice voucher, and those, of course, are not just project-based. They're also movable in the private market. But I'm now 65, and I'm trying to plan for the future, seeing this graph and all the expectations. I'm trying to identify other places where I can use my housing choice voucher. And I know, there are certain senior housing that's been developed. I'd say Lockwood, the new Lockwood facility, that I think might be 30 to 40% reduced income. I don't know how that works yet, but that's a lot more than they usually will set aside at other locations. But when you develop in Ann Arbor, it's my impression that you have to either give money into a housing fund, which I'm not sure is used for housing, or you have to set aside a certain number of units in your development. And I would hope that would apply also to senior housing. I mean, does that exist in Washtenaw County?
Thanks.
So depending on the rules with HUD, that would depend on what the set aside would be. So yes, we would set aside something when we are ready to develop senior housing, for instance. If we are able to find funding to develop a senior housing, another senior housing community, we will do so. At Lurie Terrace, we didn't develop the property. We bought it from a different owner. So we do have some project-based vouchers there. You can use a housing choice voucher at Lurie Terrace. But as for development, we haven't gotten that far yet.
I'm thinking of other people who have come into the community I'm thinking of other developers, and there are, of course, very many of them that come into the community. And I don't know if the city has rules. And Karen, I thought that you were a city employee. I'm not sure.
No, I'm not a.
You're not a city employee?
No, but I am on the Housing and Human Services Board, and I think I can slightly address your question. Like the Housing Commission just gave $3 million for a private affordable housing developer on Commerce Drive. They're getting money from the taxes that people have to pay if they do not choose to set aside apartments. But, some of the places do have, like a lot of the new housing does have housing set aside. Like, I don't know how much is at the place in Lowertown, Beekman. I don't know how many. I think there might be like 20 or 30. There's the city apartments. There's, they have so many in so many places. It's places like Brookdale that don't, that are places that are for people that have, need assisted living. And that's kind of what I was getting at, is that we really don't get on those people about providing for people that are lower income.
I wasn't aware that MISTA had run out of money. But of course, there could be many changes to HUD as an institution and a housing choice voucher, all the funding, the housing funding in the next 4 years. And so that has me also very concerned.
I'm going to find out that answer, because I know for our development at the Grove that I mentioned, it was, I don't want to say gifted, but before the developer with the $1 million condos or what have you, and I say $1 million because that's what they cost, before he was permitted, or they were permitted to develop on that land, they had to find an affordable housing partner, which that's how we came into the mix. So the county made sure that before that they would allow them to do that. And so that's how the partnership kind of formed with us. So is it a regulation? I don't know. Should it be? I would say yeah. If someone's coming in, especially a private developer, developing high rises and state of the art buildings, but I'm not sure on that. But I do know specifically for our development, that's what happened.
Listening to the numbers tonight that I was not aware of before this, and then I also saw something that came up on my computer today about a housing development that Ann Arbor Housing Commission, it's going to be the Ann Arbor Housing Commission, but and it's considered low income, but from what was said in the article that I read, and I'm wondering also about the number of in terms of the housing that's right out near Carytown, the people that we're talking about, a lot of us are thinking about, are the people that are only getting like $600, $900. And none of that housing, from what I understand, that's going up and that's Ann Arbor Housing Commission, is going to deal with those people because the rent is going to be much higher than what any of them can afford. And so what's still going to happen with the people that are in the shelter, the people, I live at Lurie Terrace, and I see the people who come in with vouchers, and if there's no other place it's going to be like Lurie Terrace, where are these people going to live? The money, I don't think, is actually going to a lot of the people that are needed, that need it. And then the services, this has been my hotbed ever since I moved in, well, ever since COVID, let's put it that way. The food that comes through on a daily basis from neighborhood something lunch services and the Meals on Wheels is not what I call adequate food. I have found that getting food from the Jewish services is much better. Lisa, I don't know what the arrangement is, if it's financial or whether they're donating, but Lisa has made some kind of arrangement so that we're getting like 50 meals for people in our building, which is wonderful. And then again, in terms of our people, I'm wondering whether the people who really, really need those meals know about it because they don't read the bulletin boards, they don't read anything. I don't know, because I've seen people go up and take food that, quite frankly, I know they can afford it. And I'm wondering about the people that are living there that actually need the food, whether or not they have been told that it's there for them. But the food that is available for seniors in this county is not edible. It is not healthy. I just don't think whoever is providing relatively free food really is being observed in terms of quality. And I have told the people that service us, go to Jewish services and find out how they cook their food and how they preserve it, because it's much better than what we're getting. I could talk for hours.
I bet
That's okay,
that's so.
yeah.
If that's Jewish Family Services you're talking about, and yes, they do have a food pantry. I don't know if you had a question too? You had your arm up.
I'll start. I also live at Lurie Terrace, which has been an absolute godsend to me because I'm from Ann Arbor, but I was actually 20 years in Ohio. But when I came back here, I would not have been able to afford living in my hometown were it not for Lurie Terrace. And then within 2 years, I had a housing voucher, which made it even better. My question is, I want to be delicate about this because but for the grace of I, be homeless, and I had that worry. But it's the experience we've had when previously homeless people come to Lori Terrace. There have been a number of concerns. There have been safety, there have been drug use concerns, there have been a number of things. What is the policy, say at Avalon, about drug use and smoking and things like that? Is it tolerated? Do you have cessation programs, which are no good if they don't want to do it? But what's the policy for drug use and smoking in Avalon?
That's an excellent question. Excellent question. So at Avalon, we practice what's called housing first. Okay, it's a term. It's a national term. Housing first is essentially we address your housing before the challenges or concerns that you face. So, can you move in Avalon or live in one of our units and be an active drug user? Yes. So what we believe is that if we build that relationship with you, we just might be able to help in that regards, right? Because I think Shannon might have mentioned it's about trust. In my experience in public housing, the incoming tenants and residents do not typically trust government. And so I always used to tell our staff is, talk to people like humans, not like robots, because we can do that in government sometimes, right? But our policies, fortunately, we can have different policies than the Housing Commission because they're governed by HUD. And at the end of the day, that's where they get their funding, and so HUD sets the rules. We are not so much governed by HUD. We do have some funding from HUD, but we practice housing first, and it can be challenging. It can be very challenging, but that's just what we practice.
And you're set up to have partners that provide services, whereas Lori Terrace is not.
Okay. Yeah. We as I mentioned earlier, we have about 70 out of our 130 staff that are more of our support workers, caseworkers. So that expertise, we have, and we can't do it alone. Don't get me wrong. We have partners, like Packard Health and things. But again, being on the side of the fence of the Housing Commission, which has been my experience, is difficult. Lisa, because they only are funded at certain levels. We do a lot of fundraising and things like that can bring in the funds to support our staff. They're a little bit more restricted, and Lisa, you know better than me, so I'll let you handle that.
The- Yeah, so the policy on smoking or drug use, specifically at Lurie, is, I don't know how to say this. It's not appropriate to smoke in the building, right? We make that very clear at Lurie Terrace. However, I have, in my experience, I will follow the protocol for lease violations, and if it gets to a point where we have to evict or move for eviction, that's what we will do. However, we're not in this field to evict people.
Thank you. We have a question here.
I got a comment too. I want to add to both of their answer about the drug policy or the outlook on it. A lot of people in this room might not have heard it before because I think it's like in the last 10 or 12 or so, 13 years. But one aspect of housing first that we all practice is harm reduction. Right. And so we pick the lesser evil. And it's, sometimes people are going to do what they're going to do regardless. So what we do is try to help them suffer as less harm from it as possible, and also to not criminalize people because they have these things going on with them. My name is Santanika. I work for Avalon. I'm the Rapid Rehousing Case Manager. When I worked for Avalon and Catholic Social Services a while back, and when I first worked with them, it drove me crazy, just so you guys know. I could not get that concept of harm reduction through my head. I could not understand what was the benefit of allowing these people to do these things. And I'm happy to say that I've grown into understanding what's that about, because they really are causing less harm at home than out in the street with those behaviors. Now my question.
I understand addiction. I worked in addiction, so I understand how hard it is.
Yeah. Okay. Now I want to ask my question. I just really wanted to answer that because it was something that was in my head for a long time too, that I didn't see how it was going to help solve homelessness, but it does apparently. I'm back and I see that it's working. My question was regarding the slide that was shown. I wanted to know, given that we have those numbers and we see those increases and we can expect those needs in the future, and we have them now, do we have any plans throughout our agencies to gear programs specifically toward that population, and specifically in rapid rehousing? Because in rapid rehousing, one of our goals is to help people who basically have hit a bump in the road and get them back on track. It's not a permanent solution, it's a temporary solution. So in that temporary time, do we see us eventually curtailing our program to fit those needs in specific? Because with a younger person, I would be working with them toward things that I wouldn't be working with a senior toward. So in the future, do we see us going in that direction?
Good question. I will let testing. Let them, if they have in their organizations, then I'll talk a little bit about ours. You know, at least from what I believe we should do. to your point, Shannon. Anything for you?
Sure. No, you know very well. Like right now, none of the housing programs are tailored towards seniors, and like we're trying to like put square pegs in round holes and make it work. But like, yeah, I mean, it's so important, especially with the millage funding.
Hold on.
The biggest obstacle that I've been running into with the rapid rehousing and of seniors is an accessibility issue in the private market. So I also wanted to know, were we going to think about curtailing programs, like not just in the private market for those seniors? Because the fear of not having the things they need is in itself becoming a barrier in me getting people housed.
We have a question in the back, and then up front, and then did you?
Beth, let me see if any.
Go ahead.
Anybody want to speak
Thank you.
towards?
I just wanted to talk about I know you were talking about the problems of people smoking, and I just want to reiterate what you said about housing first. When Avalon first came to Miller Manor, there were like a lot of ODs, a lot of deaths. Now we have Narcan. Now we have people getting safer use, kits and things. You aren't seeing people there for 3 months and gone. I mean, I don't know if you've ever experienced watching people just die, but I think you would really change your mind about housing first if you saw, that kind of crisis on a daily basis. It's terrible. And I don't know how we're going to totally address this problem of addiction, including cigarettes, because young people started smoking again, and, it's going to lead to a lot of problems down the road. But I think you need to realize that, it's something that we want to force people to change, and it's very hard to accept that you can't. and that the only thing you can do is make it safer.
Thank you, Karen.
Here, one in the back first.
If I could, Beth, oh no, you good. I just want to okay to Tantanika's question, and I'm just speaking specifically for Avalon because that was the question. I think, and that's an excellent question. I think three things when I think of what we can do. When I speak of specifically Avalon, one thing is an example is our Washington Street project in Ypsilanti. It's only 22 units, so I mean it doesn't seem like a lot. And the bad thing about development is a typical development project will take you 5 years. So we can't build them fast enough to keep up with the number. So we're hoping that this millage, just like the affordable housing millage that has passed, we're hoping that this millage will allow for more access to capital. And if we have access to capital, then that's just on the development side. But we also, I think to your point, partnerships like with Michigan Ability Partners, and really advocating because, again, going out into the private market, especially for rapid rehousing, a private market landlord is not going to alter their property, regardless if you had a voucher and the voucher will pay 12 months. They're not going to do that. It's just too costly. So, and then when we build, we build a minimum number of handicap accessible or hearing capable in terms of units. Because when we develop through MISTA, because again, we get the funds through MISTA, they only give us so much, and those units are more expensive. And so it's like everything else, it boils down to money, in terms of construction, and it's a shame. But when we develop a project, we have to show that the project will make a profit. Well, we're really not here to make a profit, but before someone will loan us money, we have to show that. So that hampers our ability to be able to provide that type of product. We did just receive a grant from MISTA, though, so I will acknowledge MISTA and thank them. So we're going to be doing some handicap upgrades to our property at Stimson, and which are the one-level garden units. But I wanted to specifically address more accessibility. So the funding and grants and things as things come available, we're going to apply and need to prioritize that. But in terms of services, I think it's just being intentional, internally, us being intentional, but also partnering with those that can advocate beside us, right? We can't tackle it alone. But to your point, yeah.
Thank you. We have one in the back, and then I'll be up front. Thank you.
Thanks a lot. I'm going to stand up just because it's easier to see y'all. I got a couple ideas I want to share on helping older adults avoid homelessness. Before I get to that, I just wanted to kind of respond to a comment earlier on the Housing Commission's commitment to housing low-income folks. I actually think our Housing Commission is really rocking on that point. We have taken the millage funding, the affordable millage funding, we are like cranking out units all over town. That Carytown site, it's probably the most walkable place in Ann Arbor. We're putting deeply subsidized units there. There are going to be people coming out of experiencing homelessness directly into that housing. And we're using the millage to make that happen. We're building lots, we're going to be building right across from the library here, hundreds of affordable housing units, making it affordable. But we're also making sure it's not all going into downtown areas. We're looking at sites all around the city. And the city's kind of a partner in that. When the city has land available, that's what's making all this possible. So I actually feel I'm pretty proud of our Housing Commission. I think we're doing good work on that. Obviously, could we do more? Do we want to do more? Absolutely. But it's one of those things where I'm like, I need to push back on that because I feel proud of the work we're doing there. So on things to do about older adult homelessness. So a couple of things that I know are happening out there. Some communities are doing shallow rent subsidies. So one of the challenges with older adults is, they'll have a spouse pass away, or they'll have some decrease in their, they're living on fixed incomes mostly, right? And when that happens, like, they are at risk of losing their housing, but with a small amount of subsidy, they'd be able to stay there. And if we can keep them in the housing with that small amount of subsidy, instead of having folks displaced and dealing with all of that down there, it ends up being much, lower investment, better for them, better for the community. So I'm hoping, I don't know if, honestly, I don't know if that's happening in Ann Arbor, but I'd love to see it happen, Washtenaw County, throughout what we're doing. And then the other idea I just want to toss out there, our home share programs, and maybe we've got one here, but that, again, a lot of older adults, they have more house than they can afford. But if we can create programs where there's other folks in need, willing and interested to share that house with them, that again can keep folks in their homes with services.
Thank you. Thank you. And that's very creative, so I want to thank you for your suggestion. Did you say shallow rent subsidy? Shallow?
Shallow.
Shallow, okay, shallow rent. I've never heard of that before, so shallow rent subsidy, yeah.
There's a couple of things. One is, I don't know, I've been here for a couple of years, but it's a hard city to navigate sometimes. Anyway, I don't know the listing. I've never seen a listing of homes for people that are homeless or low income. I came here because my daughter already gave me a place to be. So, but I don't know what the options are, and I'm not sure that, is there such a thing as a list of those homes somewhere?
Yes. Yep, there's a list.
Where?
That's a good question. But I know there's a list. I know we've seen them, and usually the Housing Commission will have a list of landlords that accept, like, subsidized housing. I'm not sure how widely publicized
Well, I mean,
it is,
like
but
places like ours. I live at Lurie Terrace right now.
sure, yep.
And I know there are others in the area, but I don't know where they're at or what they're at.
There's,
Okay.
Something had a list of.
Yeah, they do.
That's on Lurie Terrace and
there's
Okay.
that one.
I-
There's,
squares on there.
Yeah, I didn't find it. But anyway, the other question I had was, I'm from the year that your Social Security only went to a certain amount, and we're limited on that amount. And every year, the rent goes up, but ours doesn't go up, so to speak. Huh? What'd you say? Anyway, it seems like sometimes we forget that we have limited amounts, and the rents keep going up and up and up. And it's hard to, I'm not complaining, I'm just saying I've been to one show since I've been here, that's it. But you have to really be careful what you're doing, because I like to pay my way, but it doesn't keep up with things. Are you people thinking about that option sometimes? See, we have a certain amount that we have, and that's it. But and it's tough sometimes to keep going up, because every year our rent goes up. And not that that's bad, I understand it, but it really makes a difference.
yeah. So I will say a couple things. So first, there is a list. It's affordablehousing.org, and you can search for different, whatever criteria you're looking at, and many low income, just in general. Yeah, affordablehousing.org is a good place, a good resource. And at our main office at Miller, there is a list there too. And then we have landlords reach out all the time, and we have a little booklet of different things that are available. And then as for, what I'm hearing you say is you're talking about inflation and how that's affecting the rent's going up, food's going up, everything's going up. Ann Arbor Housing Commission really does try to keep the rents as low as possible, but to maintain our operations cost. So while we're looking at many different types of different funding and grants, We don't always get awarded those, so we do have to raise the rent sometimes. But we are significantly under market value for rents at Lurie. Yeah, it's hard. Yeah.
Okay. Here you go.
I guess I have a different type of question. I know the rents go up. I moved here, my rent was only maybe $750. I know that they've gotten higher in Ann Arbor, and I'm understanding that. Is there any way that I can keep my place that I live from raising my rent after I've already signed a contract?
That's an excellent question. That's a question that I don't know that I can answer. Are you in a market rate?
I don't know because I don't know. I know that there's people that pay rent that is lower than mine.
Okay.
So I know it's available. I don't have a case manager. I don't even know
Okay.
what that is.
Okay.
I've never learned about it.
Okay.
But I know I paid my rent faithfully there for 17 years.
Mm-hmm.
And yet the time that I signed my contract, now they've raised it more than when I signed it. Is there any way that I can keep from having my rent raised?
Well, the first thing that I would say is, usually it's going to have to be in your lease. They typically cannot raise your rent unless there's a clause in your lease. If there's not a clause, what I would suggest is that legal aid, it's free services. They will take a look at what's going on for you. But that would be just my suggestion because, again, I don't claim to give legal advice, but legal aid is a great advocate, for us and the community as a whole. So I would check there. But typically, market rate developments, they will raise the rent annually. I mean, I'm a renter as well.
Right.
In subsidized housing, we don't, at least for Avalon, we don't raise the rent. Our rents are pretty much set. I can't tell you when the last time we've raised our rent, but even at like places like the Housing Commission or whatever, the subsidized units, they're only raised as much as your income. So they'll do an annual recertification, and if your income goes up, then your rent may raise a bit because it's all subsidized. And typically it's no more than 30% of your income. Anything over 30% is what is called rent burdened. That's a term that's used, rent burden. So again, the market rate is a little different. Subsidized housing is different. So sounds like you might be in a development that has a multitude of units, subsidized and non-subsidized. So again, my advice would be to just contact legal aid and just have them take a look at your lease.
And rent board, go to the rent board, the new rent board that we have. They have been collecting people's narratives about what their problems are with their leases. And I can tell you that legal aid has like 7 attorneys, so you might have trouble.
Okay.
But go to the rent board.
Okay, thank you. The only other question I have is there, I've never heard about a case manager, and I'd like to find out how to get a hold of one if I needed it, because I know I'm going to need it eventually.
I can get your information and make sure we have somebody contact you.
There's also Housing Bureau for Seniors. That may be a place to contact. I think we have maybe time for one more question. Okay, maybe 2. We'll see how this goes.
Hi, so I'm from Legal Services, so it's great to be here. We definitely help folks, especially if there's any questions or just concerns around recertification and subsidized housing. So feel free to contact us. We have like a housing intake line, so you could even complete it over the phone if like getting to the office in Ypsilanti is an issue. And we're pretty, we do give pretty immediate advice, usually within 1 or 2 business days. But my question is, I recently started working in this field, and I've noticed that when it comes to my elderly clients or my clients who are seniors, even if they can currently afford their housing, they're being really quickly priced out. And it's really difficult Again, like, I do a lot of public benefits work, advising on housing and things like that. But it's really difficult because I'm not a case manager helping to direct them to resources in terms of where to go if they want to think about moving. Like specifically, I have clients who even if they can afford their housing, they can no longer afford their utilities. And so it's just like a really difficult situation. And I'm just, again, wondering from like the legal side of things, is there like specific things that we can be thinking about as a legal aid organization in terms of like systematic advocacy or affirmative cases or other things that we can be involved in the community litigation or things like that you guys have ideas about? Because I know often that we're having all these conversations, but like in different spaces. So, yeah.
Yeah, I know one, and the panels may know as well. Michigan Coalition Against Homelessness is probably the biggest advocate, at least, I don't say the biggest, but one of the well-known advocates. And right now there is a House bill, I think at the state level for income protections, and that's basically so that landlords cannot deny you based on the type of rent that you pay, meaning like if you have a subsidized, if you have a voucher, if you will. Right now they can say they can choose not to accept it. So I think there's a House bill right now. I'm not sure of the number, but I'm pretty sure there's a House bill right now for that. I've seen it passed in other communities, in Ohio. So I think that is being brought forth right now. But Corporation for Supportive Housing is another big entity that I think for your organization, and I'm sure they're probably working with them now. I mean, legal aid for me has been a great advocate, not just here, but everywhere I've been and worked in Ohio is great. We've always worked together, even when there was challenges. So thank you. But those are just some of the entities that I know that, if you reach out or contact, or I can even put you in touch with them to help build those relationships. So anybody know any?
Area Agency on Aging.
They recently changed their name to Ageways. Ageways.
Okay.
But I also, if you ever need any of this information, you can call the library, and we have a lot of the resources, gathered for seniors. We can mail the list to you, So think about that. I think we have maybe time for one more question.
Beth, there's
Wait,
one more.
Maybe there's two more questions.
No,
Wait,
if I could tell, there's a
sure.
There's a push right now, and we are on it. It's many entities that's on it. It's called it's actually it's called The Rent is Too Damn High. That's the actual name. The rent is too damn high, but it's being pushed right now, and it's a lot of entities. I don't know if legal aid is a part of it, but we signed on. Am I right? Damn. Is that what it's called?
Yeah.
Yeah, down in Lansing. So there's definitely ways.
Okay, all right. I think we got one last question. Okay, one moment.
Okay, so I'm going to be the last one. Okay, Karen, thank you for everything you said. I am Pat Strong. I know you because you were at the downtown when we were doing the Catherine thing, so I know. And now that I know what you do, people don't know who Vocal is, and we are here to pick up what you guys are overworked as it is, the people that are going out helping, that's what Vocal's supposed to do. And the whole senior thing, I have a whole packet that I wanted to present you guys with, and then I had a stroke. So I have so much to say on so many things we can do with the seniors, and it's just an awesome thing. I advocate for art supplies, knitting. I would love to see us go out to them, and especially the people with Alzheimer's, dementia, what's going on. My mother had it. I went through the whole thing just to make a visit. If we want to clean something for them, they need their bathroom clean, we'll do it. We want to hear, well, they're not that old now, stories of Vietnam. I love hearing that. I want to be the sounding board for some of these people, just to go visit And if they want to make something, I've got all the supplies. Because I write these companies, they give all the time. I just wish the food was like that, you know, fresher food. But Vocal is there for a reason. And I feel like I'm disappointed they're not here. Because you guys need to know who we are, because that's what you made Vocal for. But we are here to do whatever, and I want to get out there. You know, we just sit and eat and talk about it. Talking isn't doing anything. And I know these people need some stuff, and I want to hear their stories. I want to, like I said, we can even cook for them one night. And if you get a combative dementia person, just let them talk and we'll sit back. That's all it is we need to, we're supposed to be a family. You know, you're talking to 800 people. I didn't know it was that big. I'm too busy for that. But we've got a lot of people in Vocal that aren't showing up, including me, but I think we need to really tamp down on what we're doing. We could make a huge difference, you know, because I should know all you people. I've been, Vocal, year and a half now. And I knew you were going to ask me that.
Vocal is Voices
Karen.
of Community Advocates and Leaders, and it's a group out of Avalon.
Yeah, and we do things where we plan on things, but they never come into, you know, but please use us, because that's why I wanted to get into, you know, you guys asked me if I wanted. Yes, I do. And I think a lot of others are frustrated right now, so we're having our own meeting to see how we can get with you guys. But we need a meeting. We need more than this. We need to keep this going. Because, this town, I've been here for 30-some years. I had my business in this town, and everything fell apart. I have given Narcan out 3 times, and it's hard. It is very hard to watch. But the other night, and I think people know who she is, the lady who lives at the library pretty much every day. I don't know why she doesn't have housing, why she's not at Delanus. Man, it blew me away. I was on the bus. She's over there with a huge brown blanket in a wheelchair, sleeping there all night long. That makes me mad. That makes me angry that I want to do more. But I don't want to see her on those steps all night long anymore. No way. Not in this town. This is supposed to be the best town in the whole, you know. I mean, they overdo that a lot, but, you know.
Okay, thank you. I know this is a topic we all have a lot to say and we're impacted by. I want to thank the panelists and our wonderful moderator for being here. Thank you all. Thanks so much. Great conversation.
I have some business cards, and if anyone wants them, folks can get referred to Recuperative by any medical professional. It doesn't have to be Michigan Medicine, Trinity. It can be anybody.